Well, February marks National Heart Month. I am joined on the phone now by Dr. Ashley Bach, a cardiologist at TriStar Centennial Medical Center. Dr. Bach, thanks for being with us.
Thank you so much for inviting me to speak about heart disease as part of National Heart Month.
How appropriate that we're doing this. I feel like things did not get better overall as far as our health during the pandemic, and now is a good chance to kind of check things over, isn't it?
I think that is very true. You know, during the last few years, and specifically at the heart of the COVID-19 pandemic, many people delayed seeking medical care, as I think there has been some fear of hospitals and even of the clinics. But now I think it's an important time to regroup and start addressing some of our risk factors and thinking again about our cardiovascular care.
We got a little ahead of ourselves with what's on the screen right now, but what do you need to look out for when it comes to your heart health?
So I think, one thing that's very important is that heart disease remains the leading cause of death in both men and women in the United States, with one person dying of heart disease approximately every 36 seconds, according to the American Heart Association, which is just staggering. And the CDC notes that someone has a heart attack approximately every 40 seconds. And so as such, I think recognizing the signs and symptoms of heart disease or a heart attack is very, very important. Now, in men, men have a greater chance of experiencing a heart attack at an earlier stage in life, and they often have symptoms that we commonly associate with a heart attack, such as back, neck or jaw pain, chest pressure, shortness of breath, or vomiting and nausea.
Yeah.
Now, one thing that's important to note is that I feel like heart disease has been historically thought of as a disease mostly in men, but it's important to know that almost as many women die of heart disease as men each year too, and so it's important that we recognize symptoms in women as well.
And what are the major? Go ahead. I'm really curious about the major symptoms, way it presents itself in women.
So symptoms in women can be pretty nonspecific and can actually go unnoticed and delay necessary treatment or delay women seeking appropriate care. So they too can have some of the symptoms that we commonly associate with heart disease or a heart attack, such as discomfort in the neck, jaws, or arms, and traditional chest pain. However, they can also have very nonspecific symptoms that can include things such as fatigue, lightheadedness, lower back pain, or just feeling sick, nauseous, flu-like symptoms. And so I think those symptoms can really delay seeking care because they don't feel like they're having a heart attack as we traditionally think about it.
As far as contributing factors, is it mostly hereditary or lifestyle or a combination of both?
It's really a combination of all of the above.
Yeah.
We know there are many risk factors that contribute to cardiovascular disease. One of the key risk factors is hypertension or high blood pressure that affects about over 120 million adults in our country. But other risk factors include things like a strong family history of cardiac or coronary artery disease, diabetes, tobacco use, obesity, and physical inactivity. All of these together can contribute, and they're actually all modifiable risk factors that we can use to prevent cardiovascular disease, but require close monitoring.
And the fact is we have to commit to having a healthy heart, and it's important to go see the doctor. Dr. Bach, thank you so much for your time and the information. Very valuable.
You're very welcome, and thank you for having me.
For all the tips that you just heard, go to our website, WKRN.com. We'll have the entire segment posted in the Newsmaker section under the Watch tab.